Hello and welcome to this edition of Mental Health Minute. My name is Samantha Hammonds. I'm the Clinical Director at PCS.
And I'm Kayla Starnes, the Community Liaison for PCS. Obsessive Compulsive Disorder, or OCD, is a mental health disorder that includes obsessions and/or compulsions.
Obsessions are persistent thoughts that you may not want to have. They run over and over again in your mind and may come in the form of words, images, or urges. Compulsions are repetitive behaviors, things like hand washing or checking, or mental acts like counting or praying that are done to reduce anxiety or distress.
The obsessions and/or compulsions are time-consuming and may cause a lot of distress and impairment. Here at PCS, we offer a variety of services. However, OCD is best treated through therapy and medication management. To understand how therapy may be most helpful, it's beneficial to understand what a cycle of OCD looks like.
When someone with OCD has a distressing thought or obsession and they engage in a behavior or compulsion, their anxiety subsides. Engaging in the compulsion reinforces the anxiety. It basically tells their brain that the fear or worry they had to begin with was valid. A therapist may help someone with OCD by allowing them to experience an anxiety-provoking situation and sitting in that until their anxiety subsides naturally, rather than by using a compulsion. This is called exposure therapy.
Some medications, like SSRIs, may be also effective in reducing symptoms of OCD. If you are a current client of PCS and you're experiencing symptoms of OCD, be sure to mention that at your next appointment with your provider. If you're not a current client of PCS, you can walk into any of our 6 clinics any day of the week and we can start an intake, or you can contact our call center.
Everyone with OCD does not wash their hands all the time.
Just because someone is organized or particular does not mean that they have OCD.
You may have OCD and have obsessions and compulsions, or you may just have one of those.
It may not even be evident that someone is struggling with OCD, but their battle may be internal. Maybe you don't have symptoms of OCD, but you can still reduce stigma by talking openly about mental health.
Not making OCD jokes.
And being a safe space for those struggling with OCD or other mental health disorders.
Thank you for tuning in. Be sure to check out our social media pages all month long for more information on OCD.